Healthcare, a definition which is very familiar to each of us nowadays. Every single family needs a healthcare plan for their own members. The demand for healthcare is going to double in the next 20 years globally. So today, let's learn about healthcare industry in the United States to understand the trends, impacts, and effects on our society today.
Never before in recent history has an industry faced as much uncertainty as does the healthcare industry today. And in every business and every industry, these megatrends that we look around the corner to observe are necessary as we make our plans. What's clear is that change is constant. Demanding demographics, something about which all of us are familiar. Look in our communities at the wide range of ethnic groups. Look at the size of our households. In the grocery shelves, what we sell as individual servings rather than large packaging. And the income disparities in our population are widely discussed. Urbanization, aging, these are among the many megatrends changing the landscape of what we call the American society. They impact healthcare directly. Strategic globalization. Not a day goes by that we're not reading of a US-based company's expansion of its efforts in Asia, the Middle East, South America, or elsewhere. Not a day goes by that we don't read of mergers and acquisitions that cross oceans. Ours is a global economy. The economies of Greece, Italy, Portugal, and Spain dramatically impact the solvency and liquidity of a global monetary market. Not just the medical device, pharma, and bio companies that serve a global market, but increasingly the insurance industry. Our providers, information technology companies, and others look for growth in those emerging markets. In our lifetime, we've seen the transition from mainframe to desktop to laptop and now a mobile phone environment. Last year alone, of the 4 billion phones sold, 1 billion were smartphones. Meaningful use brings personal health records alongside electronic health records. But what's missed is that the ubiquitous demand of consumers to have control of their technologies that deliver information to them they want and need. Unconstrained connectivity, leveraging technology in healthcare, will redefine its future just as certainly as our ability years ago to diagnose and treat disease. Healthcare is 23% of the federal budget, it's 26% of the average state's budget, it's almost 20% of discretionary spending in the household. There are constrained resources in all. Healthcare, like every other industry, faces talent shortage and it faces access to capital issues. But healthcare is unusual in that sometimes we don't see those constraints and we're able to pass those through so that others pay that bill. We anticipate looking around the corner that healthcare will face constrained resources, that its compensation, its reimbursement as in the past, will not be repeated in its future. In an environment in which resources are constrained, scalability and sustainability require a bigger platform, bigger scale. Consolidation is a part of our economy. In most industries, bigger players are increasing their relative market share. Similarly, in healthcare, we start with a fragmented system, more than 400 health insurance operators, 5,800 hospitals, most independent, medical practitioners in small settings, a home care and long-term care industry that's very fragmented, and so on. We anticipate accelerated consolidation in healthcare as a major focus looking around the corner. Big data, it's an amusing phrase. It says what it means. We're in an environment in which there's massive amounts of data created every day. But there's a difference between data and information. In healthcare, every stakeholder, every sector has its own data. But what's changed is the tools to manage that data in a way that it becomes information. And what's different is the demand of the market among consumers, users, for that data. We think, looking around the corner, big data will redefine the difference between winners and losers. It's fair to say that consumer confidence is low, and it's also widely understood that consumers' quest for value is being expressed in virtually every corner of industry, from retail to financial services to professional services and others. The same is true in healthcare. More view our health system in this country as underperforming than view it one to be protected. More in this system view its underperformance a result of its waste and its inefficiency than view it as effective. And as we look around the corner, we're not going to be talking about patients or members or subjects for trials. We'll be talking about consumers. These 7 megatrends are in many ways reflective of the complexity and impact of this industry. Demanding demographics, strategic globalization, unconstrained connectivity, constrained resources, accelerated consolidation across all our sectors, consumer discontent, and the emergence of big data. Every organization in healthcare recognizes that this industry touches everyone, and it impacts everyone every day. And we have to think outside our conventional boxes. You can't predict the future. You can better prepare your business for it. That's the opportunity ahead for healthcare.
There are many companies that are operating in these industries, but today we want to talk about Atlantic Health System and Inspira Health Network.
You've changed my life.
Thanks to you, our twins got a great start.
Thanks to you, so many people with complex illnesses have a place to turn.
Because of you, our seniors have the resources they need.
I'm looking forward to my next 10 years, thanks to you.
You're helping us save more lives.
Your generosity inspires all of us to work harder.
You've helped us be the best we can be.
Thanks to you, we have award-winning nurses.
Through your support, I have medical care.
We are filling a critical need with your help.
You give me something to smile about. Thanks to you, we can reach the people who need us most.
I'd like to give a big thank you for all the donors who made this possible. Round of applause.
Your heart has touched our hearts.
You helped my mommy.
You saved my life.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Thank you.
Thank you.
Pick your heads up. This isn't over. It's far from over. You gotta want it. You gotta believe in yourself and in here in your heart. Do you believe in yourself? When you're down and out, you get up. We fall down, but we get up. This is our chance to make history. Right here, right now. Look around you. These are your brothers. This is your family. You guys gotta know that you want this. You gotta want it like you wanna live. Pick your heads up. Get out there and do what you gotta do. You gotta believe in yourself. These are the very situations that create history. And every downfall, there's what? A new beginning.
What does inspiration sound like? Is it the deafening roar of the crowd? The silence just before battle? Or does it hang on the poignant words of a leader? Here, it's the sound of new hope. A second chance. Life. It's what inspired us to bring South Jersey Healthcare and Underwood Memorial Hospital together to form Inspira Health Network. It gives easier access to skilled physicians, links you to more convenient locations, and encourages families to live healthier. This is what inspiration sounds like when you make patients feel the way we do. Inspira Health Network, inspiring medicine.
Now here is some implementation plans for Atlantic Health Systems. Increase opportunities for social interactions amongst isolated seniors. Provide mental health first aid training to professionals. Conduct recommended screenings in community settings to reach lower-income populations. Now for Inspira Health Network, they should implement health programs on a local level before expanding to larger populations. Reach out to the communities to determine what the communities think their health needs are, and from that data and analyze it, decide which needs they can address and develop strategy for those needs.